In 2017, 1.8 million people were infected with HIV, and 940,000 died of AIDS-related causes. Of the Canadians who died, less than one-sixth, or 15%, received palliative care services. Statistics have shown that few Canadians received palliative care in their final years of life. Now you might be wondering, why is this introduction important? Well, I'm here to inform you. First, let me give you a brief outline of our discussion. We will look at a brief history of HIV and AIDS. Then, we will examine a brief history of palliative care. We will then discuss when palliative care was introduced to HIV and why. Lastly, we will tie it all into the John Gordon Home. We will talk about where they are located, when they were created, and what they do. Let us begin. HIV is a human immunodeficiency virus, and AIDS is the acquired immunodeficiency syndrome caused by HIV. It was first believed in the 1930s to have originated from a virus from chimpanzees and transmitted to humans through blood from hunting. It wasn't until the 1980s that the world truly became aware of HIV and AIDS. Now we know that HIV/AIDS is most often a sexually transmitted infection, but it can also be transmitted through needle and syringe use. Also through contact with contaminated body fluids like blood, saliva, and more. Symptoms include headache, muscle aches, joint pain, painful mouth sores, and as the immune system is further destroyed, then the symptoms become worse. These symptoms can be very painful for individuals and can reduce their overall quality of life. While there is no cure, there has been breakthroughs with medications such as the antiretroviral therapy. This works to block the multiplication of HIV in the cells. While the treatments have been somewhat effective and the number of HIV and AIDS-related deaths have reduced by 43%, there is still a need for palliative care services for those who are in need of symptom management. So what is palliative care? Palliative care was thought of around the 1950s. It is an interdisciplinary approach that focuses on preventing and relieving suffering and on supporting the best possible quality of life for patients facing serious illness and for their families. This form of care provides symptom management, establishes goals of care that align with the patient's values, allows consistent and sustained communication between the patient and caregivers,